For female infertility, you want to know what's the cause. The first thing they normally do is to assess this is you have to go to the hospital to be seen. They check your reproductive organs, the anatomy. They check your vagina, your uterus, your cervix. Most importantly, they check your uterus, the lining of your uterus, to make sure that it has the right amount of thickness and there's no abnormality and there's no growth in the uterus, the womb that will house the baby. Another test they want to do is to check your hormones level. Do you have the accurate hormones to achieve and support pregnancy? Antral follicle count. This is to determine if you have enough baby eggs to mature and become eggs that can achieve pregnancy. So if you do test to check that, and also another test they do to check if infertility is to check the woman's cervix, because if someone is having normal sexual intercourse but the cervix is too tight, too close and not open, then the sperm are not getting way to where they can fertilize the eggs. So they check to make sure the cervix is patent and patent enough to allow the entrance of sperm into the uterus. They check the uterus is healthy, and there's this called HSG test. There's also an HSG test to check the patency of the fallopian tube, to make sure that the tube is patent enough to allow the movement of fertilized eggs into the uterus, to allow the free movement of the baby. And then they check the hormones level, AMH, to make sure the woman have the right amount of hormones to support pregnancy. With all of this done, there's still some women that all this test is done, everything is fine, yet they're not pregnant. Another thing that can be responsible for it is the lactating hormones, tricking the body into believing they're already pregnant, so not making it possible for them to achieve pregnancy. Another cause of infertility is anovulation. There's some women that do not ovulate. So when there's no eggs, there's no way it's possible. There's no way fertility can. There's no way pregnancy can be achieved. Another problem is women with PCOS. People believe that women with PCOS, they're just infertile as long as you have PCOS. PCOS does not mean infertility. However, it reduces the chances of being able to achieve pregnancy. The polycystic ovarian syndrome can be responsible for infertility. It doesn't mean if somebody have PCOS they cannot conceive. No, it only means that there's higher risk of infertility. So when we talk about infertility, what is it? Infertility is the inability of a couple partner living together for 1 year, having regular, frequent, unprotected sexual intercourse, and yet no pregnancy without the use of contraception. So the couple have been living together. Listen carefully, they are living together for a whole 1 year. Both of them are having sexual intercourse, no contraception, with the aim of achieving pregnancy, but all through this 1 whole year, no pregnancy, then it can be deemed infertility, and that is the time you can start and that is when you can start going to the doctor to ask for help. When we talk about infertility, people like, especially in Africa, when you just get married, everybody's looking at your belly. They're like, oh, why is you not pregnant yet? When somebody is newly married in Africa, they just look at your belly and like, why is this person not pregnant yet? What's happening? That's not how it works. Before you can say someone is infertile, they must have been living together for 1 whole year, having unprotected sexual intercourse regularly with no contraception. At the end of 1 year of this, that is when you can now determine and say, oh, this couple suffering from infertility. So let's stop pressuring people into having children. Especially some people have decided they don't want to have children. They're using contraception and they're not going to come to you to tell you what they're using. They're not going to come to you and tell you they're using contraception so that you don't bully them. So from today on, if you're one of those people that go around are looking at people's belly, asking them, why is this person not pregnant? What is wrong with them? They've been married for 1 year. They've been married for 5 months. They've been married for 2 months. They are not pregnant. Stop it. If you're one of those people looking at everybody's belly, especially after they've been married for a while, you go, hey, she's been married for 5 months, there's no baby yet. Stop it. Because you don't know what is happening. Before you can say somebody is infertile, they have to have been married for 1 year, having regular, unprotected sexual intercourse with no contraception. And you do not know, some couple just don't want to give birth yet. They want to enjoy the first year of their marriage, the second year. Some don't even want to give birth at all. So stop pressuring people to have children because you do. Please stop giving people depression, anxiety, and bad mood because you want them to be pregnant. So if somebody couple they are together, they are not pregnant yet, leave it to them. Or until they come to you and ask for advice. Stop pressuring people. There are some couple that they want to have children. They are trying so many things already. So do not make their emotional baggage bigger by asking them all the time, "Where's your baby? When are you going to get pregnant?" Please.